my name is Nicole Mathews. I'm going to be talking about my internship this summer, and the focus of my internship was identifying language biomarkers for depression and anxiety among trauma patients. So just to give a brief overview of what I'm going to be discussing, I'll give a little bit of overview of my internship, what my learning objectives were, the background information and information about the Aurora study, which was what my internship focused on. And then I'll discuss my role and the results and the data analysis from the study. And I'll also talk a little bit about the Twitter study, which was a small project I was also involved in. And then I'll wrap up with challenges, significance, and lessons learned. So to start off with an overview of my internship, I was under the mentorship of Dr. Lisa Visor, who's an assistant research professor in the School of Medicine at UNC Chapel Hill. And she is a investigator in the Aurora study, which I will describe in just a few brief slides. And just to give an overview of what my learning objectives were in my internship, I was learning to process and compare large data sets. This was using Python and Excel. I learned about how informatics and research are integrated and turning data into meaningful knowledge. I learned a bit about research grant processes and privacy restrictions involved with that. And then finally, overcoming challenges with calculations and writing code. So I'm just going to give a little bit of background information to set up for explaining what the Aurora study is. So some key terms here are APNS and trauma. So APNS stands for Adverse Post-Traumatic Neuropsychiatric Sequelae. And so this is an umbrella of conditions such as post-traumatic stress, post-concussion syndrome, depression, and regional or widespread pain. So when I say APNS, this is kind of what I'm referring to. And then to define what trauma is, this can include car accidents, physical assault, sexual assault, and other experiences. And due to the traditional assumptions about APNS, the symptoms are often generalized into a broad diagnosis of PTSD rather than being individually identified and translated into specific conditions correlated to brain function. And this absence of a dynamic diagnostic classification system has led to a reduced discovery of biobehavioral markers, risk prediction tools, and prevention and treatment. So that's where the Aurora study comes in, and Aurora stands for Advancing Understanding of Recovery After Trauma. And this is a 5-year research project designed to improve long-term evaluation and treatment of trauma-induced mental health sequelae. And the goal of the Aurora project is to ultimately enroll 5,000 participants who have experienced trauma and visited an emergency department, and it would be a year-long study. And the main objective of the Aurora study is to develop and evaluate predictive and diagnostic biomarkers for APNS. So that includes depression and anxiety, and then develop clinical interventions for trauma patients. And this is a longitudinal study, and it ultimately will analyze a lot of different types of data. So neurocognitive, digital phenotyping, neuroimaging data in the first year after a trauma experience. However, Dr. Visor, who's my mentor, was focusing on language biomarkers. So that is the focus of my internship, is looking at language biomarkers in trauma patients. So looking at how this data is collected, eligible participants will have completed a patient encounter in an emergency department, but not be formally admitted to the hospital. So they were just seen, but they were not admitted to stay in a hospital. And so this analysis of data is aiming to help trauma patients and also ultimately veterans who are experiencing PTSD and other related mental health conditions under that APNS umbrella. So trauma patients who participate in the study following a trauma incident would agree to install a mobile application on their phones to track anything typed into the keyboard of their device during the following year. And in combination with other data participants' mobile device keyboard data is currently being used to develop those biomarkers, and clinical interventions can be developed from that. So keyboard data here includes anything typed into the patient's phone, so capturing letters, numbers, punctuation, and emojis. And this data is really valuable to the Aurora study because it provides a large amount of objective data and it eliminates survey bias. And so this keyboard language can be used to draw correlations between predictive word choice and tone and a trauma outcome. So you may be wondering, well, what is this based on? So there's a dictionary called the Linguistic Inquiry and Word Count, and it's used to conduct analysis on patient language data, and it generates scores based on their word choice. And on the left, I've provided a screenshot of part of that dictionary, and the associated scores with different word categories. And LIC essentially reads written or transcribed verbal texts that have been stored in a text file. So in this case, it would be the keyboard data from the participants. And then the text analysis module compares each word in the text against this dictionary, and the dictionary identifies which words are associated with psychologically relevant categories. The daily scores were calculated based on language categories. So for instance, pronouns, positive emotion, and then it can also include very specific words such as money. And because both magnitude and variability of language measures are associated with health outcomes like depression, the mean and standard deviation of each participant's data can be used to draw correlations. So for instance, if you take the participants who have the highest depression scores, you can look at what their language use was and then draw a correlation between high severity of depression and what type of language they were using. And that's creating the biomarker. So a large part of my internship was understanding how informatics is integrated into clinical research. And so I think it's important to note the hypotheses that were formed by the Aurora team to comprehend what the results are that they were looking for. And so here's just a few examples. There were 6 hypotheses about the LIWC data. So for instance, it was predicted that participants with higher symptoms characterizing PTSD would have higher rates of using pronouns in first person, higher rates of expressions of anxiety and religious words. And you can see there's a couple others on there. So another one was participants reporting higher severity of symptoms characterizing PTSD would have higher rates of death and dying words, words focused on the past, unique words, and singular pronouns. And then these are the other 3 hypotheses. So again, another example was that it was predicted that participants reporting higher severity of symptoms of characterizing PTSD would have a lower total word volume, and that they would also have a higher rate of sensation perception words, negative affect words, and cognitive process words. And then there were also some general hypotheses created by the Aurora team. So they predicted that word use would accurately predict the severity of depression, the severity of anxiety, and that participants with higher severity of depression, anxiety, and suicidal ideation would produce higher rates of words expressing absolutist thinking. And so some examples of that would be words like absolutely, always, completely, definitely, and those are just words that are just very concrete. So now I'm going to transition into where I came into the study and what my role was. So when I began participating as an intern for the Aurora study, I started off by using multiple resources to train in Python. So that included Coursera for data analytics. I used Python training from the UNC Odom Institute, and I also used resources from the UNC libraries to get more information about Python. And I also used quite a bit of online resources for understanding how to create calculations in Excel. And then I also reviewed literature to gain a better understanding of natural language processing. And this is just a graphic to demonstrate some of the really useful articles I found for understanding natural language processing. And these kind of get into learning about language marker analysis and language association with depression and anxiety. And then one of the articles actually gets into how Twitter can reveal information about depression and anxiety based on language use. And so looking at more of the technical tasks that I was doing, this is a screenshot of the entire file of data. It comes from about 3,200 participants, and it was over 320,000 files of data. So each line was a different day of participation. And so this is a very large file. It was a lot of data to work with. And so I was working to sort it for the unique users, writing formulas for first and last day of participation, determining each participant's date range, determining how many days of information were missing for each participant, and sorting for the week 1 and week 2 data for mean and standard deviation for participants that participated more than 10 out of 14 of those days. And this comes in a little bit later in a correlation that I'll explain. So the Aurora team was able to develop this chart during my internship, and they found that there was a pretty good split between participants who used Android versus iOS, so iPhone users, and there was a little bit higher count of Android users versus iPhone users. And looking at the percentage of days within the first 8 weeks for each participant that had no word cloud data, it started off that the Android users were missing the most data, and then that rapidly declined and it shifted, and then there were more iOS, iPhone users that had missing data. So this data indicates that there was greater success collecting from Android users. And this is most likely because iOS users could turn their keyboard application off. So that was hindering the application from collecting their data. So using this, the Aurora team ultimately decided to use Android data for further analyses in the future. And then this is where that week 1 and week 2 mean and standard deviation data came into play. So using that, the Aurora team was able to create a linear regression model and a binary logistic model. And so essentially what these were saying was in the linear regression model was that from variables that were most correlated with depression scores at 2 weeks after the trauma incident, these 3 things were the most predictive of that depression score. And it was the week 1 mean of cognitive process words, assent words, and week 2 mean of negative emotion words. And then when they created a binary logistic model for the variables most correlated with the categorical depression indicator at 2 weeks after the trauma incident, for week 1 means the sadness words, post-focus, past-focus words, assent words were most predictive. And then for week 2, it was function and body words. And then for both weeks, it was present focus words. And moving on to another task that I was working on is the Freeze2 databases document is a very large document outlining all the different types of trauma that could potentially be a part of this study and be a factor. And so using that, I created an outcome spreadsheet, which is shown on the right of the screen. And in the process of doing this, I reviewed the entire document to determine each outcome category, where the outcome is described in the document, the variable name, the variable description, and where that variable can be found in the LIWC table, which is not pictured here. And so this spreadsheet is just important because it consolidates information from this very large document and the LIWC table, and it organizes it into a very large, easily accessible reference sheet. And then getting into coding, this was one of the larger tasks I was doing during my internship, was creating Python code that would calculate standard deviation and mean for the LIWC data for each unique participant at different time intervals and for every outcome. So this slide lists some of the main things that I learned when I was writing code. So I learned about importing packages like pandas and OS, reading and writing in a CSV, dealing with error codes, creating data frames, and calculations such as mean and standard deviation. So this is one of the big deliverables that I had in writing my Python code. I worked on writing standard deviation and mean calculation codes for the entire 320,000 file Excel sheet of and I received consultations from UNC Odum Institute, and this was pretty challenging. And some reasons why this was so difficult is because it needed to be in alphabetical order, the dates needed to be in ascending order. Every participant had varying days of participation. So one participant may have started in October and another may have started in January, and each one participated a different number of days, and there were a lot of participants who had missing days of participation. So it was just a lot of factors to a lot of criteria to work with in one single code. And because all of their date ranges were so different, it was difficult to just autofill Excel with blank rows where there were dates of participation skipped. And on top of that, the mean and standard deviations needed to be calculated at specific time intervals. So for each participant, we needed mean of day 0 to 14, day 15 to 60, and same with standard deviation. And so at my skill level, it was just more effective to write code for one participant file than for all 3,200 at one time. So I created this code that you're seeing right now is based on one participant, and it works on individual participant files rather than the entire file run together. And this would still allow the Aurora team to find the mean and standard deviation of each time interval for each participant. So this is the final product of that code. It generated a CSV, which I turned into an Excel file. And in the left-hand column, you can see all of the LIWC categories, and then all of the scores associated with that. And so the top row is showing the mean for each date range. So mean of all days, mean of day 0 to 14, etc. And then as it progresses, it turns into the standard deviation of all of those date ranges. And you can see in column H, mean day 60 to 90 is blank. So that indicates that that participant didn't participate from day 60 to 90. And so now I'm going to talk a little bit about the Twitter study. This was something that I briefly participated in as part of my internship, and it is very related to what I was doing with the Aurora study. So during the course of my internship, I had this opportunity to participate in one of Dr. Beiser's other research studies where researchers are comparing self-identifying PTSD patients to the general population based on Twitter data. So just looking at their tweets. And I worked with another master's student and we set up Tweepy. Tweepy allows individuals to pull tweets from Twitter through Python, and you can filter it based on specific language criteria. So we reviewed several articles on how to do this and how Twitter data can be analyzed to produce mental health biomarkers from language use. And we learned some ways to filter the tweets through the Twitter API. So that included strategies for narrowing the Twitter API search to specific Aurora locations. So using our findings, we worked on writing a Python code using Tweepy to pull the tweets based on specific location and language criteria from about the last 10 months. So now I'm just going to wrap up with talking about some challenges that I had with the data and the significance of the Aurora study and lessons learned. So to start off, the Aurora data was not delivered to Dr. Visor until July, and initially we expected that the data would be ready for analysis between May to June. So we kind of, just worked with it, and this was most likely due to COVID. So because the data analysis was delayed, we worked on other small deliverables and prepared for the data analysis while we waited on the main data. And another challenge that I previously talked about was writing Python code to conduct calculations on such a large file for over 300,000 participation dates. And this was just so challenging due to the criteria that needed to be placed on the code to sort it out properly, because once you can get it sorted out, the calculations are very simple. So alternatively, I created that Python code that works on individual participant files. And there were also some hurdles to overcome with malfunctioning software. So when I was using Excel on the Aurora data, there were often times when Excel would crash because it couldn't handle that file load. And trying to run calculations and formulas on that many files, it really just overloaded Excel. And that really showed me how valuable something like Python is, because it can handle such large data that programs such as Excel really aren't meant for. And then finally, regarding the Twitter study, we found that we couldn't access tweets properly due to Twitter restrictions. There's certain packages that you have to pay for, and even those are still limited access. Twitter won't just give you access to everything all at once. So it was a bit complex trying to get an accurate read on tweets from, say, the last year from multiple different locations based on certain language criteria. So ultimately, Dr. Visor ended up going to UNC Twitter specialist for consulting on this. And although there were challenges to completing the data analysis on the Twitter study, I did learn how to use Tweepy and access the Twitter API and find recent tweets meeting specific language criteria using Python. So for example, we could search tweets where someone used the word COVID in the last week or so from a specific location, and it would pull up all of those tweets using that word. So the purpose of this internship was to conduct data analyses that will contribute to understanding the link between trauma, mental health, and language use, and ultimately find the real world impact of that understanding and describe that. The mental health crisis is a large issue in medicine, and it still lacks significant exploration. And so the Aurora study was trying to understand and improve prevention and recovery of mental health conditions for trauma patients. And so researchers involved in the Aurora study are still working to develop biomarkers for trauma patients, and they've made a lot of progress. As you can see, in those correlations, they've already found predictors of depression based on language use in the first 1 to 2 weeks. And so this can be used in clinical practice to indicate mental health concerns. And just to recap on lessons learned, I learned several really valuable lessons from being a part of the Aurora study, which included processing and comparing those large data sets with Python and Excel. And so this included sorting data with different methods of coding in Python, writing Excel formulas, and using various data manipulation features in both platforms. And I also learned a lot about conducting calculations in both Python and Excel, executing analyses, and creating those data files. And I also learned quite a bit about the reality of research grants and methodologies in research. So although timelines are initially set at the start of a research study, it's common for researchers to experience delays and unexpected challenges. And I know COVID was definitely one of those. So for example, the data for the Aurora study, it took longer than expected to clean and deliver it. And ultimately, it can be expected that data analyses on large data sets will take a lot of time and attention to detail. And there's also multiple parties involved, so it's a strength of the research group to have all these different expertise, but it's really important to communicate effectively and understand how to work as a team to tackle these challenges, especially in this age where a lot of people are working remotely. And as an informatics student, there's a lot of emphasis on in the curriculum on patient privacy. So my experience working with the Aurora data taught me about how de-identified information should look and be handled. And the de-identification and protection of participants' identities is especially important for minimizing bias. And if you're looking at the data set, there's no indication of gender, age, race, or type of trauma specific to a participant identification number. And I think exposure to working with this data set provided a really valuable learning experience regarding patient privacy. And I also learned a lot about how to create meaningful knowledge from research data analyses. My experience taught me that informatics is a very effective research tool, and it can enable researchers to gather large amounts of data electronically and construct valuable conclusions based on statistical models. Electronic data capture is becoming increasingly prevalent in medical research. It's efficient. The usability and application has a very wide range. And so although the Aurora data study analysis is currently ongoing, my experience as an intern taught me how a study design is thoroughly planned out and how to produce that medically significant knowledge. The study was designed to make sure that the data was free of bias, and a lot of steps were taken to ensure the validity of the analyses. And finally, I learned that informatics is a very powerful tool for accelerating medical research, and it will have a very powerful impact on mental health treatments. And I just want to thank Dr. Visor for bringing me on as an intern and providing me with this experience working remotely through all the COVID things that were going on this summer. And I'd also like to thank Dr. Kitzmiller for her guidance throughout this process. And finally, I've provided my references here.